thank you everyone for attending this webinar today. So today I will introduce the real-time IntraVital microscopy technique, which you can do in vivo cellular level imaging of various internal organs in a live animal. And then it can be applied for in vivo application for various pharmacological research. So my name is Pilhan Kim from IVIM Technology. Okay, so yeah, this is the kind of our introduction slide to show you the advantage and the power of the IntraVital microscopy compared to conventional imaging technology such as X-ray, CT, or MRI. So compared to this conventional imaging technology, which can take only a snapshot in very low resolution in tissue level, the IntraVital microscopy can provide a very detailed live video in single cellular level resolution in a live animal model, as shown in this video in the middle. So this is the video obtained from the mouse model of sepsis in the lung. And in the green, you can see the blood circulation, and in the red, you can see the neutrophil inside the blood vessel. So this video clearly shows you that the neutrophil inside the blood vessel, they can aggregate and then form a cluster inside the blood vessel, and then which disturb this green fluorescent blood circulation in this sepsis animal model in live condition. So, compared to this macroscopic scale imagings, the microscopic scale IntraVital imaging can provide the very detailed 3D cellular level molecular and functional information imagings, as shown in this example. So IVIM Technology's IntraVital microscopy can enable a dynamic 3D imaging of various cellular level dynamics, such as cell trafficking, cell-to-cell interaction, and cell microenvironment interaction inside a living clinical animal model in vivo. So these are also another example of the video obtained in vivo in live animal model. On the left side, you can see the video obtained from the lung. In the middle, you can see the video obtained from the bone marrow, which is showing the movement of the transplanted bone marrow cell. Most of them are hematopoietic stem and progenitor cells. And on the right side, you can see the immune cell in the skin. Actually, most of them are granulocyte in the skin. So these are the example of the dynamic 3D imaging of cell migration and cell interaction in the live tissue in live animal. Also, for the drug development, IntraVital microscopy can enable a direct imaging analysis for the monitoring the drug delivery to get the target tissue and cell, as shown in the middle. So you can see this red color drug is delivered to this green cancer cell through this blue blood vessels. And then on the right side, what you can see is that this is the real-time video showing you the distribution of the intravenously injected nanoparticle in the liver sinusoid. So as you can see, this single nanoparticle is delivered to the liver through this liver sinusoid, as you can see here, and then they are kind of accumulated in the liver sinusoid in real time. So this kind of direct imaging analysis can facilitate to the capability to monitor the delivery of the drug to the tissue in real time, and then also it can enable the assessment of the drug efficacy and validation of the mode of action in various clinical models. So this kind of a very high resolution, single cellular level resolution dynamic video can be obtained from almost all the tissue and organs in the live animal model, especially the mouse model, by using the IVIM Technology's IntraVital microscopy system. cell. So as you can see in this slide, you can see the image, the representative image obtained from the bone marrow, brain, the brain tumor as well, retina in the eye, skin, hair follicle in the skin, and then tumor in the visceral cavity, and pancreas, spleen, small stomach, small intestine, colon, various adipose tissue, prostate, and so on. Memory tissue, kidney, and heart and lung and liver. So now I will try to show you several examples of the dynamic video obtained from the various organs inside the live animal model. So this is the preparation of the animal model for the imaging of the lymph node to image the lymphocyte trafficking. So as you can see in this photo, the mouse is anesthetized and it's placed on the temperature controlled heating pad to keep the body temperature to be stable. And the body temperature is monitored by the rectal probe, as you can see here. And then this body temperature measurement is used to control this heating pad temperature. And this is the Popton lymph node, the imaging site, as you can see here, and like this. And on the right side, when you are looking at is the IntraVital, imaging. Actually, it's time-lapse imaging of 2 hours of extravasation of the T cell and B cell in the high-dimensional venue of the lymph node. So in the middle, this is the blood vessel actually, which is called HEB. And then you can see the extravasation of these B cells, for example, these green B cells, and also red T cells as well here. So this is a very clear example to showing the capability of the IntraVital microscopy for analyze the dynamic movement of the cell in the live tissues. And this is the real-time video showing the blood flow, actually the red blood cell flow in the tumor model. So on the left side, this is the preparation of the mouse model for the human cancer xenograft. So in the middle, this is the imaging site. And then in this particular example, we create the LSGFP tumor model by using this dorsal skin fold chamber. And in the middle, you can see this blue is the pseudo color, the LSGFP tumor cell. And the red color is actually the blood vessel and the cellular cell. It's labeled, it's presently labeled by anti-CD31 antibody conjugate, which was intravenously injected through the tail vein. And then it systemically circulate the blood vessel and label all the cellular cell in the body. And at the same time, we inject the small number of red blood cells after present labeling. And then this is the real-time, 30 frames per second speed imagings. And then you can directly see the how much, how fast is the IVIS flow in the vessel around inside this tumor. And in the middle, you can see this distorted blood vessel in the tumor. And then on this left side, you can see this sluggish, very slow the IVIS flow in the vessel, which is due to the collapse of the blood vessel due to the proliferating cancer cells. And using the same method, same technique of dorsal skin fold chamber, we can monitor the nanoparticle drug delivery to the breast cancer cell. Actually, this is MDA-MB231 in the green. So this is 2 hour, 6 hour, and 24 hours imaging obtained after the intravenous injection of this nanoparticle. So at 2 hours, you can see very small number of nanoparticles, but at 6 hours, 24 hours, this nanoparticle is increased inside the blood vessel, and then also it get out from the blood vessel and then delivered to this green present MDA-MB231 breast cancer cells. So this one is more clear. So you can see after 24 hours, this nanoparticle really get out from the blood vessel and then delivered to the cancer cell. So this is a very good example. We can directly monitor the delivery of the drug to the target cell. In this case, it's cancer cell, obviously. So yeah, so any presently labeled material, presently labeled drug, including antibody or microbiological, such as including exosome, can be directly monitored to to assess the delivery to the target cell in the live animal model in vivo for a couple of hours to 1 day, or even a couple of days to several weeks, or even several months. And this is another example. So in this case, the small part of the small intestine is externalized, and then we can see the dynamic movement of the lymphatic vessel in the villi of the small intestines. And this green color is the red present fatty acid. So you can see the transport of this fatty acid through this green color lymphatic vessel. This lymphatic vessel can be visualized by using this Proxon GFP transgenic mouse. And so this is the real data. So this is for 26 minutes. You can see the fatty acid, the red color fatty acid, can be delivered to the lamina propria of the small intestine, the single villi in the small intestine, and then it can transport through the mesentery, like 19 minutes and 26 minutes. So this is the kind of peak time for this fatty acid transport from the lumen of the small intestine through the villi, and then through the lymphatic vessel, and through these mesenteries. So this kind of delivery of the material can be also done in vivo in other tissue and organs. So this is the liver actually. So in this left side, when you are looking at is the intravenously injected material, actually it's the model drugs, was delivered to the, it filled up the liver sinusoid like this. And then after 2 minutes, you can see the accumulation of this model drug into the hepatocyte. So this is all real-time observation. So this is a live observation of the delivery of the model drug to the cell in live tissue in a live model. So this is the liver. And then after this uptake, we can also see the clearance actually. So this is the 6 hours time-lapse observations. So you can see the clearance of this the delivered material over time. So IntraVital microscopy can be used to monitor the delivery of the drug and then also clearance of the drug in a live animal model in vivo. Also, this IntraVital microscopy can be used to check the function of integrity of the BBB, the blood-brain barrier. So in this example, so in this red color is actually dextran with a very small size, only 3,000 Dalton. And this green is another dextran with a much larger size, 2 million Dalton. So you can see in normal state, even this 3 kilodalton dextran cannot penetrate the BBB. But after we induce some neuroinflammatory conditions, this BBB function for this small molecular weight dextran is compromised, and then you can see the leakage of this small molecular weight dextran at day 3. But after that, this transient dysfunction of the BBB for small molecular weight drugs, for small molecular weight dextran is actually recovered at day 5. So actually, this is the same mouse observed at different time point. So this is another good example. We can test the delivery or a delivery of the material to the brain through the BBB, and then it can be done in a single animal repetitively over several days or even over several weeks or up to several months as well. And this is another data showing the pericyte coverage in the blood vessel in the brain actually. So you can see this red color is actually the pericyte. It's Ang2 positive pericyte. And then you can, and this data, this video showing over 22 hours, this pericyte coverage on the blood vessel is recovered after the induction of this, after inducing the dysfunctions. So again, so this is the very good data example showing we can track the cellular level dynamics and the interaction with the other type of cell, in this case pericyte and endocellular cell interaction over 22 hours in a live animal model in live tissues. So all these images and videos, live videos in live animal model was obtained by using the IVIM Technology's IntraVital Microscopy series. It can perform either confocal imaging or two-photon imaging or both of them in the live animal model. So everything required for in vivo imaging of a live animal is integrated in this one single box. So it can provide, it has several advantages such as easy installation, operation, and maintenance over time. And then all the this microscope hardware and software is co-optimized for live animal IntraVital imagings. So it can achieve, so it has several features, such as unique feature, including ultra-fast real-time imaging speed with four color simultaneous process imagings with live tissue motion compensation in live animal model, and then integrate all the device and apparatus for live animal maintenance during the imagings. And then we also provide a solution for various internal organs. So virtually we have no limitation in the kind of the internal organs for live animal, for live IntraVital imagings. So all of our system is equipped with the ultra-fast rotating polygon mirror scanner. It enables very high speed in vivo imaging. So maximum speed is 100 frames per second with 512 by 512 pixels per frames. This is the fastest microscope system available in the market for now. And then also by using this polygon mirror scanner, we can achieve very uniform excitation illumination over the entire imaging field of view. This is another advantage compared to the conventional resonant galvanic scanners. And then more importantly, the IVIM Technology IntraVital Microscope is equipped with the animal motion compensation functions. So in real world, in real situation, all this live tissue is actually moving like this because even if the mouse is anesthetized, still the mouse is breathing the air, and also heart is beating. So all this physiological movement translate into this microscopic tissue motions in microscopic scale. And then by compensate this tissue motion frame by frame, we can stabilize the motions and then compensate it and then obtain this high resolution high SNR images. So without this motion compensation, you will end up with these very blurred images because of these tissue motions. So this is another example. So this is the real-time video obtained from the kidney of the anesthetized mouse model for imagings. And then again, without motion compensation, you will be end up with these blurred images. So to achieve very high resolution cellular level imaging, definitely this motion compensation is required. And then our IVIM Technology IntraVital Microscopy has automated this process. So this is the real, software UI features. So as you can see, what you need to do is just activate the motion compensation options like this, and then select which color you want to use as your reference, as a guide, and then just start the image recording, and then you will get the motion compensated images automatically. And also another requirement for live animal imaging is to maintain the animal during the imaging. So most important part is temperature, body temperature monitoring and control. So all our IntraVital microscope has this heating pad and electric probe, so temperature monitoring, body temperature monitoring sensor with electric probe, and the temperature control, the heating pad, and then monitoring systems. So it guarantees the maintenance of the body temperature during the images. And then also our system has this sliding system. So you can easily, set up, prefer your animal on the plate, and the plate, and this whole plate, it can be detached, can be, separated from the this 3D XY stage, and then place it, and then put it back, and then place it under and then easily place it under the objective lens like this. So I already explained we can obtain Confocal or Two-Photon imaging, or both of them. So I guess most of you already know what is a Confocal microscope. So Confocal microscope is a kind of technology use pinhole in front of the detector to remove the fluorescence signal from out of focal plane. So by doing that, we can obtain high contrast, low background images from the live sick tissues. So the IVIM Technology IntraVital Microscopy system can obtain these Confocal images or Two-Photon imaging or both of them at the same time. So this is the example obtained from the adipose tissue, inguinal adipose tissue in a live animal model. So in this particular example, we imaged the adiponectin-free crossed mouse crossed with MTMG mouse. So all this green is actually adipocyte, and then all other red signal is other type of cells. Most of them are actually the blood vessel endothelial cell. And then this Confocal microscopy can obtain the sectioned imaging, so we can achieve this very high resolution subcellular level images in the live tissue in vivo. And also, this Confocal imaging, by using the IntraVital Confocal microscope, we can obtain this high resolution, lipid droplet imaging in the liver of the mouse model. So this is the repetitive image obtained from the mouse model with MCD diet to induce the fatty livers. So you can see the increase of the lipid droplet in the mouse model over time. So these 2 days after this MCD diet, you can see the formation of the numerous small lipid droplet. And then after over time, this lipid droplet increase in size like this. So again, by using IntraVital microscope, all this data was obtained by using Confocal imaging mode. We can see the progression of the fatty liver in a live mouse model. And then also we can monitor the change of the blood vessel in the cancer model, in the tumor model. So as you can see, day 7, day 10, and day 13, you can see the increase of this tumor cell, this green color, LHGFP cells, and the change of the blood vessel, like this 7, 10, and 13. You can see the dilation of the vessels like this. And Two-Photon microscopy, and we also provide the Two-Photon microscopy as well. So Two-Photon microscopy, it uses longer wavelengths, near-infrared femtosecond pulse laser. So it can achieve the sectioning. It can achieve the sectioning because the fluorescence signal is intrinsically generated only at the focus, as shown in here, compared to the single photon confocal imagings. And then by using longer wavelength laser, it can obtain deeper tissue penetrations. And then it's also capable of label-free, non-linear multi-harmonic generation imaging, such as second harmonic generations, SHG. This second harmonic generation can be used to detect the collagen or other regular protein fibers in the biological tissue in live animal model, in live tissues. So which is, and this capability, this second harmonic generation capability is particularly useful to monitor the fibrosis model. So this is the liver fibrosis model images and steatosis model. In red color, this is a lipid drop. Red color is a lipid droplet, and green color is actually the collagen fiber in the liver. It's label-free images. So by just simply detect the second harmonic generation signal using two-photon microscope, we can detect the collagen deposition and then lipid droplet at the same time, as shown in this example. So this is another example data. In this case, the the fatty liver and fibrosis was induced by a high-fat diet for 27 weeks. Then, as you can see, compared to the normal control, normal diet mouse, you can see the increased hepatic lipid droplet in red color. Then you can also see the increased collagen deposition in the liver in green. And then obviously this two-photon microscope provides the sectioning. So it enables the 3D observations of this. And then also we can see the blood vessel at the same time in live condition as well. And in this example is what we are looking at is actually the Psi1 YFP. So it's a neuromuscular junctions in the muscle of the live animal model. This is actually Psi muscle. And then also second harmonic generation, in this case, this second harmonic generation signal can be generated from the collagen fiber, like this Strix line, this collagen fiber. And then also the second harmonic generation signal is generated from the myocyte sarcomeres. So this periodic structure is actually sarcomere in the myocyte. So we can see the myocyte muscle, and then we can see this green nerve, actually, this neuromuscular junctions, nerve end at the periphery in the muscle. And then also at the same time, we can see this blood vessel as well, labeled by CD31 antibody conjugate. And this is a maximum projection images. So you can clearly see the shape of the neuromuscular junction in vivo. And then recently we are providing this MS2 model. This is a two-photon microscope. It's fully integrated with the compact femtosecond pulse laser module inside, like this. So this whole system is equipped with the laser system inside. So you don't need this bulky, Ti-Sapphire femtosecond laser for two-photon imagings. And then the main box, this main box size is very small, only 500 by 620 and 470 millimeter with depth and height. And then so we can save the space. And then we had this sliding blind to completely cover the sample stage below the objective lens. So we don't need the dark rooms. And then everything is integrated. So you just need this small space to install this two-photon microscope system. And of course, we can obtain this very high resolution image from various tissues and organs. And then we also provide the IntraVital image processing software as well. So IVIM Studio, so you can separate the color and then observe it in 3D and also in 4D. So we just take a 3D image in time-lapse manner, and then we can play by using our software, and then we can observe how the cell is moving around inside the in 3D biological tissue in live animal model. Like this. So this is another demonstration of a 4D imaging data set. Okay, so I just showed you, several organs, but this kind of high resolution images and video can be obtained from all other tissue and organs, as I shown in this slide. And it has been published in many journals. And then we also provide the various training and then support program as well. So this is the YouTube video showing how to prepare the live animal model for lung imagings. So like this. And then we use the sterilization window chamber for using suction micro vacuum and stabilize the lung. And then after this setup, by using under the microscope, we can obtain this real-time high resolution image from the lung of the sensitized mouse model. So we can provide the apparatus and then also protocol and then solution for the live lung images. And then it can be also applied for heart imaging as well, using the same device, the similar shaped device. And this is a video showing the dorsal skin-fold surgery, chamber surgery for cancer geographic imagings. So it's also on the YouTube, and then also our application specialist can show you and then train you how to prepare this mouse model. So this is the we expose the subcutaneous tissue and then remove the small portion of the skin, and then fill up the space and then inject the cancer cell in the hydrogel. And then prepare it like this. And then we can use our sliding system. So place the live model under the microscope, and then use our system to obtain this, to monitor the direct delivery in the cancer model. Now also we can take this real-time images as well. And this is the surgical procedure for the brain imaging. So this is very well established cranial window surgery models. So a small portion of the skull was removed, and then replaced it with the cover glass, very small slide cover glass. And then using UV epoxies, we can, sit up, you can close the expose the area like this. And then we can image the brain using our microscope. And then under this setting, after this surgical procedure, the same mouse can be obtained over 1 month like this, after inducing the single vessel microinfarctions. And then also with the same setting, we can select the time point and then observe the several level changes over like 24 hours like this, as I explained to you before. And then we can also test the BB functions, how this BB function is maintained or not. And then additionally, the IVIM Technology also provides the IntraVital imaging research service as well. So basically, we provide the consulting service to how to use IntraVital imaging technique for your experiment. And then we can provide the test imaging result for validation and optimization of the imaging plan. And then we provide the quotations. And if you accept it, we prepare the animal model and then perform the in vivo imaging and test the drug. And then we perform the image processing and analysis to monitor the direct delivery and clearance, and then also efficacy, and then provide the final report. So this is the exemplary project we have been done. So in this case, we monitor the delivery of the exosome. This red color is the exosome, and then this green color and blue color is actually the target cells. So as you can see here, So 10 minutes after the exosome injection, you can see the attachment of this exosome to the surface of the cell and internalization at 30 minutes after the exosome injections. So this data clearly shows that this exosome can be target delivered very rapidly into the target cell in vivo in real live animal model through the intravenous injections. So our instrument and then our microscope model and the research service can be is explained in our full product service catalog. So it's available on your request. So if you have a question or if you have any request, please send us an email to information@ivimtech.com, ivimtech.com. And also you can visit our website, www.ivimtech.com. So thank you very much for your attention.